161. What is the priority nursing action for a patient with MI and a troponin level of 1 nanogram per milliliter post-PCI? Answer: continue telemetry monitoring and notify the provider. Rationale: elevated troponin post-PCI indicates ongoing necrosis. Monitoring and notification detect complications, per AHA/ACC guidelines. 162. What should the nurse do for a patient with MI and a history of COPD? Answer: monitor respiratory status and avoid non-selective beta blockers. Rationale: COPD complicates MI management. Selective beta blockers and monitoring reduce risks, per AHA guidelines. 163. What is the nurse's first action for a patient with MI developing papillary muscle rupture? Answer: notify the provider and prepare for surgical consultation. Rationale: papillary muscle rupture is a surgical emergency. Notification ensures rapid intervention, per AHA/ACC guidelines. 164. What should the nurse monitor in a patient receiving simvastatin post-MI? Answer: monitor for muscle pain and liver dysfunction. Rationale: simvastatin risks myopathy and hepatotoxicity. Monitoring ensures safety, per AHA lipid guidelines. 165. What is the priority nursing action for a patient with MI and a new onset of chest pain during activity? Answer: stop the activity and administer prescribed nitroglycerin. Rationale: exertional pain suggests ischemia. Nitroglycerin relieves symptoms, per AHA/ACC guidelines. 166. What should the nurse teach a patient about smoking cessation post-MI? Answer: use nicotine replacement and join a cessation program. Rationale: smoking increases reinfarction risk. Support aids quitting, per AHA secondary prevention guidelines. 167. What is the nurse's first action for a patient with MI showing first-degree heart block? Answer: notify the provider and continue telemetry monitoring. Rationale: first-degree block is usually benign but requires monitoring for progression, per AHA arrhythmia guidelines. 168. What should the nurse do for a patient with MI and a history of renal disease? Answer: monitor renal function and adjust medication doses. Rationale: renal disease affects drug clearance, increasing toxicity risk. Monitoring ensures safety, per AHA guidelines. 169. What is the priority nursing action for a patient with MI and a new onset of orthopnea? Answer: elevate the head of the bed and notify the provider. Rationale: orthopnea indicates heart failure. Elevation and notification manage symptoms, per AHA heart failure guidelines. 170. What should the nurse monitor in a patient receiving ticagrelor post-MI? Answer: monitor for bleeding and shortness of breath. Rationale: ticagrelor risks bleeding and dyspnea. Monitoring ensures safety, per AHA antiplatelet guidelines. 171. What is the nurse's first action for a patient with MI showing ST elevation in posterior leads? Answer: notify the provider and prepare for PCI. Rationale: posterior STEMI indicates circumflex or RCA occlusion, requiring urgent PCI, per AHA/ACC guidelines. 172. What should the nurse teach a patient about caffeine intake post-MI? Answer: limit caffeine to avoid heart rate increases. Rationale: caffeine stimulates the heart, increasing myocardial demand, per AHA dietary guidelines. 173. What is the priority nursing action for a patient with MI and a new onset of irregular pulse? Answer: assess heart rhythm and notify the provider. Rationale: irregular pulse may indicate arrhythmias. Assessment and notification guide treatment, per AHA guidelines. 174. What should the nurse do for a patient with MI and a family history of hypertension? Answer: educate on blood pressure monitoring and lifestyle changes. Rationale: hypertension increases MI risk. Education prevents complications, per AHA secondary prevention guidelines. 175. What is the nurse's first action for a patient with MI developing acute pericardial effusion? Answer: notify the provider and prepare for pericardiocentesis. Rationale: pericardial effusion risks tamponade. Notification and intervention are critical per AHA/ACC guidelines. 176. What should the nurse monitor in a patient receiving nebivolol post-MI? Answer: monitor for hypotension and fatigue. Rationale: nebivolol, a beta blocker, lowers blood pressure and may cause fatigue. Monitoring prevents complications per AHA guidelines. 177. What is the nurse's first action for a patient with MI and a troponin level of 0.4 nanograms per milliliter? Answer: continue telemetry monitoring and repeat troponin levels. Rationale: a rising troponin suggests MI. Monitoring and repeat testing confirm diagnosis per AHA biomarker guidelines. 178. What should the nurse teach a patient about driving post-MI? Answer: avoid driving until cleared by the provider. Rationale: driving increases stress and risk. Clearance ensures safety per AHA rehabilitation guidelines. 179. What is the priority nursing action for a patient with MI showing ST elevation in leads V3R, V4R? Answer: notify the provider and prepare for fluid administration. Rationale: right ventricular STEMI, V3R, V4R, requires fluids to maintain preload per AHA/ACC guidelines. 180. What should the nurse do for a patient with MI experiencing fear of reinfarction? Answer: provide reassurance and educate on symptom recognition. Rationale: fear increases stress. Education empowers patients per AHA psychosocial guidelines. 181. What is the priority nursing action for a patient with MI and a blood pressure of 85/55 mmHg? Answer: notify the provider and prepare for vasopressors. Rationale: hypotension may indicate cardiogenic shock. Vasopressors and notifications stabilize the patient per AHA/ACC guidelines. 182. What should the nurse monitor in a patient receiving valsartan post-MI? Answer: monitor for hypotension and hyperkalemia. Rationale: valsartan, an ARB, lowers blood pressure and retains potassium. Monitoring prevents complications per AHA heart failure guidelines. 183. What is the nurse's first action for a patient with MI showing multifocal PVCs on telemetry? Answer: notify the provider and assess for electrolyte imbalances. Rationale: multifocal PVCs suggest ischemia or electrolyte issues. Notification and assessment guide treatment per AHA guidelines. 184. What should the nurse teach a patient about monitoring for heart failure post-MI? Answer: report weight gain and swelling immediately. Rationale: these symptoms indicate fluid overload, requiring urgent care per AHA heart failure guidelines. 185. What is the priority nursing action for a patient with MI and a new onset of pleural effusion? Answer: notify the provider and administer prescribed oxygen. Rationale: pleural effusion may indicate heart failure. Oxygen and notification manage symptoms per AHA guidelines. 186. What should the nurse do for a patient with MI and a history of hyperlipidemia? Answer: monitor lipid levels and educate on statin therapy. Rationale: hyperlipidemia increases reinfarction risk. Control reduces complications per AHA lipid guidelines. 187. What is the nurse's first action for a patient with MI showing ST elevation in leads V7, V9? Answer: notify the provider and prepare for PCI. Rationale: posterior STEMI, V7, V9, indicates circumflex occlusion, requiring urgent PCI per AHA/ACC guidelines. 188. What should the nurse teach a patient about physical activity post-MI? Answer: start with light activity and follow cardiac rehab guidelines. Rationale: gradual activity prevents strain per AHA rehabilitation guidelines. 189. What is the priority nursing action for a patient with MI and a new onset of loss of consciousness? Answer: assess pulse and initiate CPR if pulseless. Rationale: loss of consciousness may indicate cardiac arrest. CPR and assessment are critical per AHA-ACLS guidelines. 190. What should the nurse monitor in a patient receiving edoxaban for MI? Answer: Monitor for bleeding and liver function. Rationale: Edoxaban, an anticoagulant, risks bleeding and hepatotoxicity. Monitoring ensures safety, per AHA guidelines. 191. What is the nurse's first action for a patient with MI developing late pericarditis? Answer: Administer prescribed NSAIDs and notify the provider. Rationale: Late pericarditis causes inflammatory pain. NSAIDs and notification manage symptoms, per AHA guidelines. 192. What should the nurse do for a patient with MI and a spouse worried about prognosis? Answer: Provide clear information and refer to support services. Rationale: Clear communication and support reduce family stress, per AHA psychosocial guidelines. 193. What is the priority nursing action for a patient with MI and a heart rate of 115 BPM post-PCI? Answer: Notify the provider and administer prescribed beta blockers. Rationale: Tachycardia increases myocardial demand. Beta blockers and notification stabilize the heart, per AHA guidelines. 194. What should the nurse teach a patient about managing diabetes post-MI? Answer: Monitor blood glucose and adhere to anti-diabetic medications. Rationale: Diabetes worsens MI outcomes. Control reduces complications, per AHA guidelines. 195. What is the nurse's first action for a patient with MI showing new ST elevation post-thrombolytics? Answer: Notify the provider and prepare for rescue PCI. Rationale: New ST elevation suggests failed thrombolysis, requiring PCI, per AHA/ACC guidelines. 196. What should the nurse do for a patient with MI and a history of sedentary lifestyle? Answer: Refer to cardiac rehab and encourage gradual exercise. Rationale: Inactivity increases cardiac risk. Rehab promotes recovery, per AHA secondary prevention guidelines. 197. What is the priority nursing action for a patient with MI and a new onset of bibasilar crackles? Answer: Administer prescribed diuretics and notify the provider. Rationale: Bibasilar crackles indicate pulmonary edema. Diuretics and notification manage heart failure, per AHA guidelines. 198. What should the nurse teach a patient about follow-up appointments post-MI? Answer: Schedule regular cardiology visits and report new symptoms. Rationale: Follow-up prevents complications, per AHA post-MI guidelines. 199. What is the nurse's first action for a patient with MI showing Mobitz 2 heart block? Answer: Notify the provider and prepare for temporary pacing. Rationale: Mobitz 2 risks complete block, requiring pacing. Notification ensures intervention, per AHA ACLS guidelines. 200. What should the nurse do for a patient with MI experiencing social withdrawal? Answer: Encourage social engagement and refer to support groups. Rationale: Withdrawal worsens mental health. Support improves recovery, per AHA's psychosocial guidelines.